Hello guys, this is Dr. Possibility from Excel Academy. In this tutorial, I am focused on my part 2 of birth defects. Please make sure that you subscribe to our YouTube channel and make sure that you register with Excel Academy. Let's quickly get started. So in this question, we have been asked to name the condition which has been shown. So if you look at this condition, you need to understand that there are some intestines that are lying outside, and these intestines are not being covered by the amniotic cavity. As a result, this condition is known as the gastroschisis. What causes this condition? So you need to understand that this condition is caused by the loop of bowel that extends the closure defect in the vertebral body. This condition is also caused by the exposure of the pregnant mother to chemicals. Let's quickly move on and look at the next slide. The next slide, we have been asked to name the condition. So if you look at the condition of this child, when you focus at how the eyes are looking, the nose and also the mouth, you can understand that this is just fetal alcohol syndrome. What causes this condition? This condition is normally caused by the abusive use of alcohol during pregnancy. Let's quickly move on and look at the next slide. But before we look at this slide, please make sure that you watch part 1 of our revision on birth defects. So name the condition which has been shown. So if you look at this condition, you need to understand that the neural tube has not closed on the cranial and upper spinal cord region. As a result, this condition is known as anencephaly cranioschisis. What causes this condition? This condition is normally caused due to the failure of the neural tube to close on the cranial region and upper spinal cord. And then you need to understand that this condition can also be caused due to lack of use of folic acid during pregnancy. As a result, this condition can simply be prevented by the use of folic acid during pregnancy. Let's quickly move on and look at the next slide. So this slide, we have been asked to name the condition. So if you look at this condition is known as the word encephalocele. The reason why it is encephalocele, we need to understand that this is due to the protrusion of the meninges, cerebral fluid, and also the brain tissue. Make sure that you know that this condition is caused due to the stated reasons. And this condition is also as a result of ossification defect in the bones of the skull. Let's quickly move on and look at the next question. The next question, we have been asked to name the condition which has been shown. This condition is known as occipital meningoencephalocele. The difference between meningoencephalocele and the encephalocele is that for meningoencephalocele, this is just involving the protrusion of the cerebrospinal fluid and also the meninges. In this case, the brain is not being protruded. So that's the cause of this condition. And this condition is just also being caused due to the ossification defect in the bones of the skull. Please make sure that you subscribe to our YouTube channel and make sure that you register with Excel Academy. So please, as you go out there, remember to be kind to everyone you see, because one act of kindness will surely save a lot of lives. Thank you very much for joining me. This was Dr. Possibility from Excel Academy.